Steve-O and Renee. Sit back each week while Steve-O and Renee educate you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve-O and Renee with today's expert in their field.
Good afternoon and welcome to another Ask the Expert show where we bring you the top experts in the fields of health, legal, financial, and home improvement. I'm sitting here with my beautiful co-host, Renee.
What's happening?
Her last name is Renee too, so we just call her Renee.
I would say I'm like Cher.
Okay. So we're here every Monday from 4 to 5 p.m. If you'd like to watch today's show, we could actually go to our guest website.
It's www.sultansurgicalcenter.com. Is that correct?
That's correct.
I hope we're set up already. But anyway, this is, of all the shows that we do, this is very dear to my heart because I suffer from sleep apnea.
I suffer from it also.
You used to. Okay, you used to.
Because of you.
So, as you know, we always try to find the top expert in the areas for both Broward and for Palm Beach, and we found one. We have Dr. Leslie Sultan with us today. Hey, Dr. Sultan.
Welcome to the show, Dr. Sultan.
Thank you very much.
So tell everybody a little bit about your background and your practice.
I am a board-certified oral and maxillofacial surgeon. I've been in Broward County practicing for about 26 years, and one of my subspecialties is treating surgical disorders of the upper airway for snoring and sleep apnea.
So that is your specialty?
One of them, yes.
Okay. One of your many specialties.
No, he really does have a lot of specialties.
No, I know that.
But this is one of my main interests.
Well, I think this affects so many people.
Sure, it definitely does.
And so many
Definitely
people
does.
who don't know they suffer from sleep apnea, too.
Very true, very true. A large percent of the population snore, and a certain percentage of patients that snore do have obstructive sleep apnea syndrome and don't know it.
And, you know, a lot of people don't know the dangers of sleep apnea because you say sleep apnea. When someone said, I think you might have sleep apnea, it's like, so what? You know, what's sleep apnea?
But there are ramifications if you don't treat it.
If sleep apnea goes untreated, there are a lot of health issues related to memory, related to cardiovascular effects. Patients are more prone to fall asleep while they're driving. They have higher incidence of getting into automobile accidents. Very potentially dangerous disease.
Wow.
So now, do you practice solely in Broward, or do you also practice in Palm Beach County?
No, at this point, I am solely in Broward County. My office is in East Fort Lauderdale, and I practice at a number of hospitals in the area.
So what are some treatment options for sleep apnea?
Well, again, treating sleep disorders is really a spectrum of disease. And the key in treating sleep apnea, whether it be surgical or non-surgical, is really pinpointing the exact areas of blockage in the airway. Because the definition of obstructive sleep apnea syndrome is the disease sleep apnea caused by a blockage somewhere along the airway. And the airway can go anywhere from the tip of the nose down to the vocal cords. What I try to do and what I pride myself in doing is treating patients according to site-specific problems. I don't treat patients according to the hammer and nail philosophy, where if you're a hammer, I'm a nail, and everybody gets treated the same way, and that's just not what we want to do. Every patient is unique, every patient's condition is unique, and they're treated specifically according to what they need themselves.
Right, but you also do surgical procedures as well.
Yes, we do.
So it's not just the machines or the air strips or anything like that. I mean, because you see a lot of different practices doing, the mouth guards, different types of things, but you'll actually do a surgical procedure to get rid of the obstruction.
Correct. My practice focuses on those patients that have been diagnosed with obstructive apnea. They've worn their CPAP device. They either can't tolerate wearing the CPAP or they just don't want to, or they're using an oral appliance and they're using CPAP and they just want something more.
You know what? From our last show, I learned something I did not know. that I have a CPAP machine, and I hate it. But it does help me.
Go to Dr. Sultan.
Well, listen, but it's almost like after hearing you talk last time, it's like I'm just putting a Band-Aid on it. That's not really curing anything.
But unfortunately, nothing we can do is curing the problem. I wish that we can say that we can cure obstructive apnea. CPAP itself is probably the best non-surgical option that we have. The problem with CPAP is that, number one, it's a cumbersome device.
Absolutely.
Which I'm sure you know very
Yes.
well. Number two, there's a certain amount of noncompliance over time, meaning that after wearing a CPAP for a certain time period, a certain percent of patients just don't use it. And once the CPAP is stopped, the benefits of CPAP stop as well. So surgery will give a permanent fix, or hopefully a permanent fix, to the results that patients were getting with CPAP.
Right, so this is why you fall asleep when I talk to you during the day. I thought I was boring.
That should be one of the questions I ask every one of my patients.
And that's right, because
He does. He falls asleep while you have a conversation with him.
Well, Renee, I go 4 nights with no sleep, because
That's not true, Dr.
I'm
Sultan.
cleaning the house, and I'm
not true.
wiping the windows and all. No, okay. So what you're saying is that, and I could see when you said auto accidents, how would people do? They fall asleep at the wheel.
Yes, they do.
My father has. My father has sleep apnea. He actually fell asleep at a red light.
That's one of the questions that we ask every one of our patients when they come in order to assess the severity of their apnea. Patients will go through a subjective questionnaire. It's called the Epworth Sleepiness Scale. We put patients through 8 different scenarios, and we ask them what their likelihood is that they're going to fall asleep in that scenario. And the higher the score, the more likely they are to have the apnea.
So some of our listeners right now and viewers, they're wondering, God, I wonder if maybe I do have sleep disorders. What are some of the questions on there that people can see if they might be
What are
a
some of the
candidate?
signs that you have sleep apnea?
Well, as you said, getting tired during the day, being able to fall asleep at a moment's notice, either in your car, at rest at a stop sign, watching TV, sitting down for a few minutes and just resting. Number 2, if you have morning headaches, frequent urination at night, being irritable. Those are more of the common
Do you know I
signs.
fit all that criteria? I do.
And you snore. Did I tell you? Did you snore?
Oh, thank you very much. Why'd you tell 50,000 listeners?
So now, these are just some of the signs that people should ask themselves. Now, they can live in Palm Beach and come see you still.
Of course,
Okay.
we don't turn anybody away.
So tell everybody what the steps are. Say, someone thinks they might be a candidate, might have sleep apnea. Do they come to you first, or they go to take the sleep test like I did, where I had to go to the hospital and actually stay overnight?
Well, it's really up to the patient. Many patients get referred to me by their sleep medicine specialist, either their primary care physician, a sleep lab, their pulmonologist, sometimes their general dentist who's been treating them with an oral appliance. Many of these patients that have already been diagnosed with sleep apnea have already gone through a sleep study, whether it be a hospital-based or a home-based study. And there are other patients that just come in that know that there's something wrong, but they don't know where to go. And then if they do fit the criteria for a sleep disorder, I'll be sending them for the sleep study.
What actually causes the snoring?
Well, the snoring is due to a vibration of the soft tissue somewhere along the airway.
So, and that's usually one of the signs. And I'm going to tell you, if you think you do possibly might have a sleep apnea and you have a better half, you want to get it fixed, because it can really, really hurt your relationship.
Well, and your health as well.
Sure, health is primary importance.
Yes, absolutely.
So let's talk about some of the areas that
Different
you can do
types of surgery, yes.
Sure. What I'd like to do is everybody should close their eyes and picture their airway as an hourglass. Okay, as you all know, an hourglass will narrow at some point along the tube. The ideal airway space is a straight tube without an obstruction. If you put a bottleneck somewhere within that obstruction, you're going to get a narrowing or a decrease in airflow at that point. That's the area of obstruction. Now, there may be one area of obstruction. There can be a number of areas of obstruction. Depending upon where that blockage is, there are different procedures that we can perform in order to relieve the obstruction. And those procedures are based, number one, on the location of the obstruction, number two, the severity of the obstruction, and number three, how long the patient's had the problem for as well, and what their previous treatment has been.
Okay. Listen, by the way, if you have a question for Dr. Sultan, you might think that you might have sleep disorder and you have a question, or maybe your husband snores or your wife snores, you can call us at 888-565-1470. That's 888-565-1470. Dr. Sultan, give the phone number at your office again.
Sure. Before I do that, I will provide a correction, because the politically correct term to use in this situation is the patient's bed partner.
Oh, okay.
That's right. Absolutely.
We have to be politically correct.
Exactly. So are there new treatments on the horizon? Anything new coming out?
What is really a contemporary way of treating sleep apnea is really concentrating on the airway that goes from the oral cavity down south. So the main areas of blockage at that point are the soft palate area. Everybody knows about the uvula, which is a little muscle that hangs off the back of the throat. One of the areas that we really focus on is the base of the tongue, because in almost all patients with obstructive apnea, that's going to be the primary cause of blockage. And also we look at jaw structure. Many people that think about somebody typically with obstructive apnea is going to think about a patient who's overweight, who has a large neck size, tends to have a lot of excessive soft tissue. But we see a large percentage of patients that come in that are very thin. Why do they have sleep apnea? What we're finding is that their facial profile, based on their jaw structures, their upper jaw, the lower jaw, and chin, are deficient, meaning that it's pushed back to a certain degree, and that blocks off the airway. So I tend to concentrate with obstructive patients is concentrating on the palate, base of the tongue, and the jaw structure.
Okay.
What are some of the health conditions that you could get if you don't treat sleep apnea?
Well, patients with apnea that go untreated are more at risk for developing cardiovascular disease, high blood pressure, stroke, cardiac arrest. Okay, patients that have a high predilection for sleep apnea, their memory, anxiety disorders, also diabetes.
Wow.
Can you snore and not have sleep apnea? And
Sure.
vice versa?
Sure. A nice corollary that we use is that not all patients that snore have sleep apnea, but every patient that has sleep apnea does snore.
Okay.
What's the difference between snoring and sleep apnea?
Very good question. Snoring, basic run-of-the-mill snoring, is due to vibration in the airway caused by a partial collapse of the airway, as opposed to obstructive sleep apnea, where there's a blockage in the airway that's a complete blockage.
So you could treat both surgically.
Yes, we can.
We're going to go to break. When we come back, I want to talk about some of the other, what you feel about some of the things that dentists are doing today. I want your feedback on what you think is the best way to treat, if you can treat sleep apnea. We're going to be right back with Dr. Sultan.
The Sultan Center for Oral Surgery is proud to be chosen as the top apnea and dental implant clinic for the Ask the Expert show. They offer the full scope of the specialty of oral and maxillofacial surgery, with emphasis on dental implants, TMJ surgery, snoring and sleep apnea surgery, facial implants, and jaw reconstruction. Are you looking for a way to treat your snoring or sleep apnea in Fort Lauderdale or Broward County? Whether you have a snore you can't ignore, or have been told that you stop breathing at night, you may be suffering from obstructive sleep apnea syndrome. If you suffer from snoring and sleep apnea in Fort Lauderdale, being deprived of oxygen while you sleep can result in poor sleep patterns, daytime tiredness, poor memory, irritability, and strain on the heart and lungs. At Sultan Center for Oral Facial Surgery, their commitment is to provide you with the finest, most current, and sophisticated treatment available. Call them today for a free consultation at 954-771-8772.
back. We're here with Dr. Leslie Sultan, the expert when it comes to sleep apnea. He's a surgeon also.
So tell us some of the surgical procedures that you do for sleep apnea.
Sure. I guess the more popular procedures that we utilize in our practice, or we call it our armamentarium, is we perform procedures on the palate, a three-dimensional reconstruction of the soft palate in order to open up the airway. We also perform procedures called tongue-based suspension procedures, where the internal muscles of the tongue are basically held in place. So when you go to sleep and your tongue would typically fall against the back of the throat, it stays in place. For patients with really severe sleep apnea, we also perform procedures where we can actually bring the jaw structures forward and open up the airway that way.
So are there different levels of sleep apnea? Like obviously some more severe than not?
Of course. Based on based on the results of the sleep study, patients are categorized according to how many times they have a respiratory event per hour.
Right.
And they're categorized as mild, moderate, or severe. What we tend to see is that as the severity of the apnea increases, the number of sites of blockage and the severity of the blockage tends to increase as well. So the more severe the apnea, the more number of blockages, and possibly the more number of procedures that we can do.
I was wondering, the dentists now, they're kind of getting into sleep apnea.
Yeah, the mouth guards.
Doing the mouth guards. Are those any good?
Well, mandibular advancement appliances or oral appliances for sleep apnea definitely have their place in treating sleep disorders. They work very well when they are, when the patient's diagnosed properly and they have an anatomy that allows the appliance to work. The same thing, if the appliance isn't worn, the effects of the appliance go away. So, I put CPAP and the oral appliance into the same category.
Oh, okay.
You've got to use it to get the effect. If you don't use it, then it's not going to work. There are some other issues with wearing oral appliances that I tend to see for patients long term. For example, if you grind your teeth at night, and your jaw joints or your TMJs are overly sore, the oral appliance is not going to work for you.
Interesting.
Number two, what I've seen long term, the oral appliance actually pulls the lower jaw forward. By pulling the lower jaw forward, it brings the tongue forward, it opens up the anatomy of the soft palate. But by wearing the oral appliance for a very long period of time, patients sometimes can develop a permanent underbite with their jaw, and it can affect their jaw position in their teeth. And that's something of a concern as well.
I would think that the best option would be to have it surgically corrected so you don't have to worry about any of the appliances. Is that always for snoring or sleep apnea, what's the percentage of people, that come into your office that end up needing surgery?
We always recommend non-surgical options first. And for myself, I will never talk a patient into surgery. The best thing that I can do is educate the patients as to what their options are, what I think, which option is the best option for the patient, and use my experience to kind of guide them along a certain way. But a patient really needs to make that decision on their own.
No, I understand that, but the fact still remains is that it's not being treated. You're just covering it up at night with the CPAP machine, and then throughout the day, like especially Steve-O, he's snoring or sleeping.
During the day?
During the day, he's snoring. If he falls asleep, he's still snoring during the day. Obviously...
That's her pet peeve. They thought it was me.
I'm just saying, you're not going to obviously walk around with that CPAP machine all day long. Or falling asleep or, just tired. You're tired throughout the day also.
But we have to give a patient a realistic expectation of what they can expect with the results of any surgery. Patients will come to me and say, "Does surgery work?" And I'll say, everything is a relative term. Success is very relative, and we have certain standards that we use. Success is gauged according to what article you read, what the literature states. No procedure out there is going to be 100%
Of course
effective. Right. No surgical procedure is going to be 100% effective. So patients need to put what surgery can do for them into perspective compared to the results that they've had with the CPAP or the oral appliance.
Does insurance cover this at all?
Fortunately, it does.
Oh,
Oh,
good.
it does.
Fortunately,
Okay.
it does. Even Medicare will cover the surgical procedures for sleep apnea. But again, depending upon the insurance policy, we always obtain prior authorization, and there are certain criteria. For example, certain carriers will require a patient to go through a CPAP trial. They'll require them to go through a sleep study to see what the severity is. So again, we can't just say, okay, we're going to walk in and do your surgery next week. We
Right, it's not
have-
across the board.
Correct, but for the surgical procedures that we do, by and large, the majority of insurance companies will cover in general. There are some procedures that insurance companies do consider new on the market or investigational. We have to work a little bit harder to get those approved.
I'm for the surgery.
You know what?
I am.
But I got to tell everybody, the CPAP machine, I know I don't snore anymore. I mean, that is it's eliminated the snoring, right?
During the evening hours.
Okay. That's the only time I wear it.
That's what I'm saying. During the day, if you fall asleep, yes, you snore.
But I think, if there was a surgical way that I could be treated, that I wouldn't have to wear the CPAP machine. Is that right? Or do you still have to wear the CPAP?
It really depends. For example, let's say you come in and you have a really severe case of sleep apnea, and we propose a certain series of procedures for you, and our criteria for success is at least a 50% reduction in the number of respiratory events you have per hour. That may only bring you down to a mild form of apnea, where you may still need to have either an oral appliance or the CPAP, but again, you're not going to be as dependent on it as you were before, and maybe the airway pressures are not going to be as high as they were before.
Now you see all kind of ads on TV, online. Stop snoring.
breathe strips.
1995.
The breathe strips.
I mean, there's all kinds of things out there that, can that actually work?
Well, all I can say is that some people have a hammer and nail philosophy, where if you're a hammer, everything else is a nail.
Right.
Okay, every patient is going to get treated the same way. You can't do that because every patient is an individual. Their airway is different.
I can't get you to say anything bad about anybody, can I? I was hoping you would say, don't waste your money.
I'm being very politically correct today.
So what happens if a patient, they can't tolerate the CPAP machine or an oral appliance, so they have no choice but to have a surgical procedure?
Well, again, my job is to educate patients. It's to really pinpoint where their issues are, what their options are, and guide them along to making, for them to make the right decision. You can never force a patient into surgery, because
No, of course not.
if you force a patient into any procedure and they get the result they want, then it's a
They're
home run.
thrilled, right. But
They're
if not,
thrilled.
yes.
But if they don't get the result that they want, then you look like the bad guy. That's what we call the informed consent process. Anything that we do in healthcare, any kind of procedure that we do, we always go through the risks, the benefits,
Right,
the
so what are the
complications.
pros and cons of both, of the CPAP versus the surgery?
Well, CPAP is non-surgical.
Right.
Okay, it's very easy to use, it's very simple, and it's probably the most effective non-surgical option for treating sleep apnea, and it's very effective. But on the other hand, compliance is an issue. Patients can develop some nasal breathing problems wearing the CPAP. Some people just cannot get used to wearing the mask. It's cumbersome to use. Surgery, on the other hand, is surgery. Surgery is a non-reversible procedure. So once we do the procedure, there's no going back. But at the same point, the surgery can give a long-term fix to a problem that CPAP can't do.
Do you ever have to go back in 5, 10, 15 years later to correct anything after the surgery?
Depending upon what we do, for example, let's say we will treat a patient with multi-level airway obstruction and we get a really good result. If that patient comes back 5 or 10 years later and gains 30 pounds, they start drinking a few glasses of wine at night, they're taking tranquilizers at night, their lifestyle habits change, we can't guarantee that the results are going to be permanent. Certain procedures do have a certain amount of relapse, and we do have to go back later on.
I wanted to ask you if is the recuperation time, is it very long when you have the surgery?
Depending upon what procedures we do, certain procedures we do in the office.
As an outpatient?
As an outpatient, either under local or sedation, and those are very quick for patients to bounce back. There are other procedures that require a hospitalization. Some of them come and go the same day. Some of them have to stay a day or two in the hospital. So it really depends on what we're doing.
Give everybody your phone
Yeah.
number again in case they want to
Sure.
set an appointment with you.
954-771-8772.
And tell them where your office is located.
Sure. We're located at 4800 North Federal Highway, Suite 201 in Fort Lauderdale, just south of Commercial Boulevard, across the street from Holy Cross Hospital.
You know what? Even if you live in Palm Beach, I'm telling you, you need to go see Dr. Sultan.
Even just for a consultation, right?
The reason why is because, listen, you can go Google all day long. It doesn't mean whoever's got the biggest ad. You have a great website. You have a wonderful educational website.
That's what I love about my website. Every patient that comes in for a consult, we have a large screen TV in our consult room, and I refer to my website for everything. So that way, patients have questions, they go right back to the website. And again, everything that I do is about education.
So tell everybody about your website. Tell them where they could find you.
Sure. It's www.sultansurgicalcenter.com. I'm in the process right now of building a microsite that's specific for sleep disorders. There's going to be a lot of interactive information in terms of filling out a snore score online or filling out the Epworth Sleepiness Scale online. And it just gives you a lot of information to sit back and say, this may be something that I need to look into myself.
There's a lot of people out there walking around with sleep apnea right now who don't know they have it, or maybe don't
I may
think
be
they
one
have
of
it.
them.
But listen, you want to get it treated, though. You don't want to
Absolutely.
walk around like this and, like you said, possibly have an automobile accident. Not only hurt yourself, but hurt someone else. And when they come into you, you're going to give them all the different options, which I didn't get that. The physician I went to 8 years ago basically said, you need a CPAP machine. But I love the way you do. You give them all the different options. You let them decide what's best for them.
Right. Even if it's a procedure that I don't do, even if it's a technique that I don't believe in, patients should be aware of it. Okay. There are, certain newer procedures on the horizon that just got FDA approved, and, people read about it on the internet, and, a few of them are things that I don't particularly perform, but I know about them, and I'll be glad to educate the patient about them, or even steer them to people who do those procedures.
Israel's working on a new CPAP machine that weighs less than 2 pounds. You're talking about traveling with your CPAP machine. So they're working. I was reading about that the other
Really?
day. We love having you on the show. I mean, this is, to me, such an important topic, and we've got the best.
Absolutely.
Give them your phone number one more time.
Sure, 954-771-8772.
We're going to go to break, and thanks, Dr. Sultan, for coming
Thanks,
in today.
Dr. Sultan.
Thanks for inviting me.
When we come back, we have attorney Tina Leward, our family attorney.
We'll be right back.
The Sultan Center for Oral Surgery is proud to be chosen as the top apnea and dental implant clinic for the Ask the Experts show. They offer the full scope of the specialty of oral and maxillofacial surgery, with emphasis on dental implants, TMJ surgery, snoring and sleep apnea surgery, facial implants, and jaw reconstruction. Are you looking for a way to treat your snoring or sleep apnea in Fort Lauderdale or Broward County? Whether you have a snore you can't ignore or have been told that you stop breathing at night, you may be suffering from obstructive sleep apnea syndrome. If you suffer from snoring and sleep apnea in Fort Lauderdale,